Nalam software company. We started doing software for hospitals, especially for hospitals like 5 years ago. We built with just an OP version and we gave it to like 1 or 2 hospitals. But the response from that hospital and the people who were associated with that hospital liked the product and then came back to us for more and more, and we slowly built, keep on building, adding more and more features, and now it's like an enterprise application which can cover any hospital from like 1 bed, 2 bed, 200 bed, 150 bed. So we are officially approved by Indian Medical Association of Tamil Nadu, and we are the number one I would say in Tamil Nadu for all the hospitals. So we have installed it in 150 plus hospitals in the last 2 years after associating with the Indian Medical Associations, and we had a celebration for that. This is the video that we are playing from that. So we invited all our client doctors and they all showed up, and then they all praised the product, and it was a good show we had like in July. And we are adding more and more features, and we are evolving the product to the next level. As of now, we have it the hospital centric. Now we are changing the paradigm to the patient centric. So we are introducing new products, 3 new products. One called an Alam Dot, which is the patient centric product, cloud based, which will connect the patient from home to their doctor through the video platform. So video consultation platforms, the telemedicine is what we are talking about even in the conferences this morning, and even the inauguration meeting they mentioned. So that is exactly what we are doing. So it is not about connecting a patient to any doctor who is available. So what we are planning to do is the primary physician, the primary doctor that the patient usually visits to, and the primary doctor who knows more about the health conditions of the patient. So we want to connect that doctor with their patient so that they would know each other and they would know each other's health, and the understanding is more in this scenario. So that is exactly what we are trying to do. So Nalam Dot is the product that we have launched in July. So it's in beta mode, and from January I think it will be it will take off. Yes, telemedicine and the transforming healthcare through the IT itself is a big thing. And since Apollo is conducting it, last year we attended it in Bangalore, and see, we can read about so many things in internet, in papers, about what is e-health and how it is happening in around the world. But in this conference is the place where you meet all these people, come all over from the world, and they share their experience. So this morning I was attending a conference where people from United States, and there was there was a doctor from Brazil who gave a speech through Skype. So those are all the experiences that we don't read it in newspaper. So those are all the experiences that we want to learn, and we want to get direct information from them and grow with that technology. This conference is doing well, yes. Bangalore, I would say, was a bit better than this in the ambience wise, but here it is not bad. I would definitely enjoy this conference. One thing, the message to the organizers I can give is that even in the last conference I mentioned that the people who are coming from all over the world, they are brought to the conference hall and they deliver the speech, and then they are taken back to the hotel and things like that. So if it is possible for an interactive session, or if those visitors from abroad or those speakers can visit the stalls, like few minutes in every stall would be really helpful, I think, because they would also know what we are doing and those kind of things. So apart from that, I think this is a good conference. We really enjoy it.